I'm Mark Ruba with your coronavirus facts. First, on this Thursday, the Monroe County Legislature approving hazard pay for some county employees working through the COVID-19 pandemic. It is for workers on the front lines or those who have to work extra hours because of it. We're told the payments will expire December 31st or when the coronavirus state of emergency has been declared over in Monroe County. Public health officials say Monroe County is flattening the curve. There's been a significant decrease in the number of deaths per day from COVID-19. Still, one more person has died of the disease, bringing the death toll to 113. There are now 1,368 confirmed cases in Monroe County. Steuben County has 227 cases and 2 additional deaths, bringing the total there to 37. Yates County remains the lowest with 28 cases and 1 death in our region. Monroe County getting the green light to resume elective surgeries. 35 counties statewide made the list. Areas without a significant risk for a surge in COVID-19 cases were approved for elective surgeries by the state. Rochester Regional Health and UR Medicine have already begun rescheduling these procedures. Because New York is losing billions in revenue due to the coronavirus, classrooms will lose state funding as well, and that could lead to major budget cuts in the next school year. According to the governor's office, school districts could see up to a 30% decrease in state funding. For Penfield Central Schools, that's anywhere from $5.5 to $8.5 million.
Because of the COVID-19 cost that the state is incurring, then that gets sort of passed over to the schools, which is where that 20 to 30% decrease is coming from. We've had tight years and we get through those. This is unprecedented because it's happening so late in the budget process.
Governor Cuomo says he'll release the state's financial plan by mid-May. It will include the final numbers on funding reductions for schools. Dr. Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases, expressing optimism yesterday about finding a possible treatment for COVID-19. Currently, there are no FDA-approved treatments for the coronavirus, but a drug called remdesivir is just one of many being looked at. During a meeting yesterday, Dr. Fauci announced the results from a study of more than 1,000 coronavirus patients treated with either remdesivir or a placebo. The data showed an improved recovery time from 15 to 11 days for those treated with remdesivir.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important.
Any approval would be for emergency use only at this point. Dr. Fauci pointing out the findings do need to be peer-reviewed. As always, stay tuned to News 8 for the latest and follow us on Facebook and Twitter as well. From all of us here at News 8, be well and thank you for watching.